And I'll be the tech in the room who mucks up the tech. So, the other way. You've already seen half of my presentation. We have been around since 1902. Thank you, Chris, and thank you for that introduction. I appreciate being called the Quiet Achiever. Obviously, we've been around in Australia a long time and in these other countries variously. So Singapore came about because we were asked by the ministry, so then we did become the product of the nation. New Zealand, we embarked on them. They didn't have a choice. And the UK as well, back in 2018. Our model and what we have learnt from that journey over those different jurisdictions has helped each of the different countries that we're in. And that's in terms of security, service types, and expanding the program and the software to support all different areas. So in Singapore, we support home nursing, residential care, and they're still called nursing homes, and senior care centres. In New Zealand, we're in retirement living and then rest homes and private hospitals. In Australia, we are in residential care, home and community care, and a range of different services that our clients have put us in and used us for. And the UK, domiciliary services, residential care, and a whole range of other little things that we are not familiar with here in Australia. So what we had to do in order to do that and to provide the services to this many clients was really look at, and the awards that we receive, I've got one for 2024, I've got to put it there in 25, but we had to look at with all of the different service types that we had, for example, in New Zealand, the villages, what in the future would they need as well? And that's how we have grown our product over that time. New Zealand, interestingly, only 2 of the services, retirement living services that use us, don't have residential aged care as part of their model. And the rest home or private hospital or services that they utilise and what they use our program for is quite predominantly care as well as operations. So our product base is also in Australia, as I mentioned, and we do have, and thanks to John, we do have Bupa and Calvary and Hammond Care, Wesley Mission Queensland, we have Queensland Government, South Australia Government, Victoria Government. So we have from 10 beds to 16,000 beds installations. And that means too that we've learned with all of these experiences with all these different clients how to make sure we have an enterprise system, how to make sure that we have a broad spectrum of support, and that includes configuration, settings capability, and a whole range of other things. So why could an organisation use our product for all their services? Because of the configurability, because of the flexibility of the product. So you can have a completely different look if you're using the system in the retirement village versus what you're using in the senior care centre or the rest home or the nursing home residential care. So it's really important that whatever software model that you have, that it can take you through that journey with that resident or client from admission right to separation, whatever that might be. And Hammond Care, I did ask John, and he said, yes, please tell them my quote and you can join him on LinkedIn. So we were very proud when this decision was made, as we are proud to be the supplier for all of our clients. But the main reasons they said they chose or selected Leecare was because of our reliability, our configurability, and our sector experience. And that broad experience. Since 1992, we were a software company in 97, but from 92, the program and the product that we sold to the sector were consulting services and accreditation and support, and then a lot of sanctions and nurse advisor services. From 97, when I got sick of writing hand care plans and assessments, I used my physics background colleagues who I had studied with in applied physics to write a software system. And that's literally what we've built on over all of that time. So I am a nerd, John knows that, so he has respectfully said, the successful digitisation of our care and medication management for residential aged care with our partners at Leecare, Rolling International, who are the consulting group that they used, matches effectively the Cerner Corporation's EMR solution used across hospitals. So for us, that was a fantastic accolade, obviously. And the point being there too, medication management. We are the only and the first product that has ENRMC e-prescribing medication capability. We are the only software system that is submitting 6 monthly prescriptions to the National Prescription Delivery Service at this moment. So yes, we'll have vendors catching up soon, but we can still say that. So, we don't just look at, and this is the suite of products that we have, care, we look at operations. Our products include operations, a Platinum 6 care and lifestyle, community, and what is required for that model. Medication management, yes, but an app for staff on the ground or in a person's home, an app for the families, for the residents, for loved ones, for them to communicate with you, your photos, your documents, your news and your newsletters, but also care information and preferences. And then in residential care, the monthly care statement that you want to submit is automatically available in the app, for example, and a range of other features that that app has. TelTouch, we just purchased the TelTouch company. Now that's because with surveying becoming much more important and knowing the lived experience of your residents, your families, your staff, being so embedded within the new standards as well, we needed, and frankly, shortcut and not spend 2-3 years building a product like this. We needed to buy the product, and that's what we did. So now our team are utilising that for visitor management, staff surveying, resident surveying, as well as lived experience monitoring. The products, if you're going to use private aged care, HighCall, why did they select us and what products are they using? Well, they are using our operations, our finance, they're using our care and lifestyle product. HighCorp, are a beautiful organisation here in Sydney who have used that private aged care model in their construction, in their mission and in their delivery. And it's an interesting model that if you want to meet with Patrick and the team, I'm sure they'll share their experience as well. HighCorp is a new build, it's a new world, and the private aged care sector is very much now, and we can see part of our inquiries, part of those who are interested in looking at our software. So all of these types of products, and so if you're looking at private aged care and what type of software you need, well, in the sectors that we are in, the primary community care, the senior care centres, retirement living, that effectively for us is what private aged care, all of those components of our system are utilised and needed for the private aged care. We're in residential care, and as I mentioned, some of our clients have used us, and we are being used by Resolution Queensland, for example, for young care. We've got disability services across Perth and WA using us. We have palliative care programs and companies using us, as well as active ageing. And that's the Singapore model. That's where what they've done is 5 million people ageing very quickly, requiring attention and not residential care. What they have the most strongest area that they support is senior care centres and active ageing centres to reduce people going into residential care. And what happens is daughter and son go home or go to work, and then at night time the person returns back home to be with them. Now that's not our model in Australia. One simple has to do that, they don't have the space. However, we have an opportunity with private aged care to do something really quite different and quite wonderful. And we are still the best in the world. I keep telling everyone that. And to achieve this, we need to have interfaces. We have generic APIs. We have to have, and we do have 60 different interfaces with different products, because purchasing or licensing best of breed that you want is important for us, for you to achieve, because we don't want you to be upset with us. We don't want you to not like what we have. We want you to choose what you need for your service management, and we'll interface with it. So EV, who you're going to hear about next, the wonderful technology and hardware. We've been working with EV for a number of years in a Singapore home, where it was laundry tags, door access, weights and vital signs monitoring, a whole range of other things in the hardware space that is important in different areas. So the interfaces, government systems, medication systems, finance, CRMs, care and lifestyle, other ones, benchmarking, risk management, catering, quality life apps. learning management, rostering, payroll, patient information systems, the list goes on. And that is also something, if you're going to purchase software, licensed software, make sure it has that capability, because then you have choice. And that's what's really important. Otherwise, you're not going to get the buy-in of your staff. Change management is too difficult. So we understand that. You need the data to flow, as you would be telling us as well. You need the data to flow. It has to be congruent. You don't want anything different in one system to another and cause risk and cause issues. So we're very cognizant of that, and that's why we do make it that you have an all-in-one suite, data congruent through our model of software. And that means our apps, real-time help. And we have now 4 apps with the Staff on the Ground app or in-home app, the Resident Client Family Journey app and Communication app, TelTouch, the surveying app, and Careful, the last one that we've brought into the suite. And that is a health professional chat, professional communication app, which is basically WhatsApp on steroids, with email and text and phone call not being required anymore, because the app and the GP who got us into this 2 years ago, he goes to the gym, he's 70, he has 80 residents in one facility, and he all runs it from his app, and he's in there 1 day a week. And he does say to us, I was just at the gym the other day and I got this. I said, Henry, what are you doing at the gym all this time? Really, at that time of night, at that time of day? He said, I've got a life. And so, quite seriously, the staff know if they call or if they send something, normally that gets missed. But if they actually have it in the app, Henry's got the task calendar, he's got the action list, he's communicating with the speech pathologist who's linked into the app by the nursing staff, with the dietitian, with the physio, whoever it is as part of that particular client's journey is linked by the staff to the app for that client. So there's a holistic health professional group. And you can also send something to a family from that as well if you need to. This is what you need from software, I would suggest. This is what will help, and certainly in that private aged care space, these are the things to consider. If you're going to have care as a model and support as part of your delivery of services, client administration, resident notes, forms, care plans, messages between staff, all of this has to be congruent. All of this you should have in one system that will assist you to make sure and ensure that you don't have that incongruity of information and those silos of information that cause risk. Task allocations, KPI dashboards, business intelligence, all of these are the sorts of things that we've had to build over the years with the different nodes that we have. Operationally, looking at your staff and your supply management, your maintenance, your inventory, your document library, these are the icons on our operations front page. Incidents, hazards, risks, quality and continuous improvement, linked to your continuous improvement plan, linked to your meetings manager, linked, and education credentialing. All of these aspects, as well as obviously finance and reports, you can get in various different other systems. I've put it all into one because we could see that journey needed to have, the journey of software for a client needed to have a broad base of functionality, and that's why we've built it over these years. So Platinum 6, you do want to know about the cat or the dog, the pet. You do want to have that and the plan of that. You do want to know about the caravan. You do want to know, so it's not just about care either. It is using the system to be useful to you. So you know what's in your village, you know who's in your village, you know what you need to potentially support. So care lifestyle is more than just in a village sense or in a private aged care sense, more than just the care of the person, because as Chris was saying, you've got the emotional needs, the psychological needs also to deal with and to support. The mobile app, as I mentioned, point of care, voice, manual data entry, services, task calendars, and all sorts of charting, as well as your GPS if you've got to have somebody go home or go to a person's home. So all of that type of functionality, and the My Care Plan app, as I mentioned, the sharing of the documents, the photos, the newsletters, etc., as well as their goals, their preferences, and their care plan that you have worked through together. And one thing to mention before I finish about our TelTouch app that we've just purchased is the 80 languages, which I'm so proud of. We have a wonderful, diverse, multicultural society here in Australia, and we are now looking at expanding this into Singapore as well as our New Zealand branches. But Australia, 80 languages, including Aboriginal and Torres Strait Islander languages, has been something that Teltouch spent many years developing and creating for the sector, and we're getting that beautiful benefit of. So hopefully, if you're interested in talking to us, you'll come and see me after or contact one of the sites that we have. Thank you, Chris.